role of emergency departments is expanding, yet ERs are severely affected by the competing pressures of shrinking resources and increasing demand. This demand is going to increase with the Affordable Care Act and also because of growing elderly populations.
It's been a really rough last 4 or 5 years, and the environment has gotten worse for healthcare in general, but especially for emergency care.
The results from our new report are simply alarming. While the hospital emergency department will strive to provide the best of care, these grades show the failure of our nation's policies to support emergency patients. The national grade worsened to a D+ since 2009, when the U.S. received a C-.
Each of the states get graded on 5 different areas, and that includes access to care, quality and patient safety, public health, medical liability, and disaster preparedness.
In this report card, the nation received a near failing grade of D- for access to emergency care. At the state level, 21 states received Fs in access to emergency care, and 14 states received Fs for disaster preparedness. Despite the threat of terrorism and other disasters, the national grade for disaster preparedness was only a C-. With so much changing in healthcare, emergency care is the one place people can always go. It's never been more important to our communities. Congress and President Obama must make it a national priority to strengthen emergency care's medical system. Emergency physicians are calling for a congressional hearing.
It's very clear that the emergency departments play a key and critical role within the healthcare system.
We have to improve. People's lives depend on emergency care, and our nation's policies are not supportive. Everyone hopes their communities would perform as well as Boston did after the Marathon bombing. Congress needs to hold a hearing, and policymakers need to start supporting this high-value system that is critical to America.